Zolinza, also known as vorinostat, is a medication used to treat a specific type of cancer called CTCL, which stands for cutaneous T-cell lymphoma. It helps to slow down or stop the growth of cancer cells in the body. It is important to take Zolinza exactly as prescribed by your doctor. The usual recommended dose is 400 mg once daily, and it is typically taken with food. Be sure to follow your doctor's instructions on the best time to take this medication. Before you start taking Zolinza, make sure to read the patient information leaflet provided by your pharmacist. Take this medication by mouth with food as directed by your doctor, usually once daily. Swallow the capsules whole and do not crush, chew, or open them. To prevent dehydration while taking this medication, make sure to drink at least 8 glasses of water throughout the day, unless your doctor directs you otherwise. The dosage of Zolinza is based on your medical condition and response to treatment. It's important not to increase your dose or take this medication more often than prescribed, as it will not improve your condition any faster and may increase the risk of serious side effects. It's also important to note that since Zolinza can be absorbed through the skin and lungs, women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the capsules. If you find that your condition does not improve or worsens while taking Zolinza, be sure to inform your doctor. Some common side effects of Zolinza include tiredness, loss of appetite, weight loss, dizziness, dry mouth, change in the sense of taste, hair loss, headache, or cough. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. Nausea, vomiting, and diarrhea can also occur and may be severe. Tell your doctor right away if these effects occur. Your doctor may prescribe medication to prevent or relieve them, or recommend eating several small meals, avoiding eating before treatment, or limiting activity to lessen the nausea and vomiting. Zolinza may cause serious side effects, but your doctor has prescribed this drug because the benefit to you is greater than the risk of side effects. Your doctor will carefully monitor you to decrease your risk. Contact your doctor promptly if you notice any symptoms of dehydration, such as unusual decreased urination, unusual dry mouth/thirst, fast heartbeat, or dizziness/lightheadedness. Zolinza may rarely affect your blood sugar levels, leading to symptoms of high blood sugar such as increased thirst/urination. If you already have diabetes, check your blood sugar regularly and share the results with your doctor. This medication may decrease bone marrow function, leading to a low number of blood cells such as red cells, white cells, and platelets. This can cause anemia, decrease your body's ability to fight an infection, or cause easy bruising/bleeding. Tell your doctor right away if you develop any of the following unlikely symptoms: unusual tiredness, pale skin, signs of infection, easy bruising/bleeding, or signs of stomach/intestine bleeding. Tell your doctor right away if you have any serious side effects, such as signs of low levels of magnesium/potassium/calcium in the blood, blood clots, chest pain, trouble breathing, fast/irregular heartbeat, severe dizziness, fainting, or signs of a serious allergic reaction. If you notice other effects not listed, contact your doctor or pharmacist. Before taking Zolinza, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to any inactive ingredients in the medication. It's important to also discuss your medical history, especially if you have liver disease, mineral imbalances, or a history of blood clots. Zolinza may cause dizziness, especially when combined with alcohol or marijuana. Avoid driving or operating machinery until you know how the medication affects you. It's important to limit alcoholic beverages and speak to your doctor if you are using marijuana. This medication can also affect your heart rhythm, leading to serious symptoms that require immediate medical attention. The risk of heart rhythm issues may be increased if you have certain medical conditions or are taking other drugs that can cause heart rhythm problems. If you have low levels of potassium or magnesium in your blood, you may be at a higher risk for heart rhythm issues. It's important to talk to your doctor about using Zolinza safely, especially if you are taking diuretics or have conditions that cause severe sweating, diarrhea, or vomiting. Before undergoing surgery, inform your doctor or dentist about all the medications and herbal products you are using. Older adults may be more sensitive to the side effects of Zolinza, especially heart rhythm issues. If you are pregnant or planning to become pregnant, you should not use Zolinza, as it may harm an unborn baby. Both men and women should inquire about reliable forms of birth control during and after treatment with Zolinza. It is not recommended to breastfeed while using Zolinza, as it is unknown if the drug passes into breast milk. Consult your doctor before breastfeeding. It's important to be aware that Zolinza can interact with other medications, which may affect how they work and increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription, non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Zolinza include blood thinners such as warfarin and valproic acid. Always consult with your healthcare provider before taking Zolinza with any other medications. If someone has taken too much Zolinza and has severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center for assistance. It is important not to share Zolinza with others. While taking Zolinza, it is important to undergo certain lab and/or medical tests, including complete blood count, kidney function, blood glucose levels, and blood mineral levels such as potassium, magnesium, and calcium. It is crucial to keep all medical and lab appointments and consult your doctor for more details regarding these tests. If you forget to take a dose, take it as soon as you remember. If it's close to your next dose, just wait and take the next dose as scheduled. Don't take a double dose to make up for the missed one. Make sure to store Zolinza at room temperature, away from light and moisture. Avoid keeping it in the bathroom and always keep it out of reach of children and pets. Do not flush Zolinza down the toilet or pour it into a drain unless instructed. When it is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.